Welcome to the training for healthcare professionals. Let's begin with the module on pulse oximetry. Let's take a look at the key learning objectives of this module. After completing this module, you will be able to describe what pulse oximetry is, perform pulse oximetry, understand the limitations of pulse oximetry monitoring. What is pulse oximetry? Click each image to know about pulse oximetry. Pulse oximetry means measuring the level of oxygen saturation in the body. The oxygen level in the human body is an indicator of the well-being of a person. The pulse oximeter is a portable bedside monitor. It is either electrically powered or battery operated. A pulse oximeter continually measures the oxygen level in blood and the pulse rate of a patient. The process of pulse oximetry helps doctors and nurses to monitor the well-being of patients regularly. Pulse oximetry is needed to quickly ensure that patients have enough oxygen in their blood, to monitor the effectiveness of oxygen therapy, to assess hemodynamic instability, for example heart attacks, to identify respiratory illness, for example asthma, to monitor patients when respiratory depressant drugs are administered. Click the image to know to whom pulse oximetry is applicable. All patients undergoing bronchoscopy or other invasive procedures require pulse oximetry. Patients on ventilators. Any patient who appears hypoxic, that is, low on oxygen. Pediatric patients who are acutely ill. Patients who may require anesthesia for anxiety and/or pain control. Unwell patients who are being transported and require oxygenation assessment. A physically fit and healthy person has an oxygen saturation level between 95% and 99%. The possible cause of results below 90% may be lung diseases such as COPD, breathing difficulties, or cigarette smoking. Pulse oximetry is usually documented as SpO2. Items needed are 1. A pulse oximeter, 2. An alcohol swab, 3. Soap, water and a towel for hand wash. Now let's learn the pulse oximetry procedure. 1. Explain to the patient that an oxygen saturation reading is needed and obtain the consent to continue. 2. Ensure that the patient is comfortable and warm enough, especially if continuous monitoring is needed. Shivering interferes with the pulse oximeter reading. 3. Wash your hands. 4. Check the probe and ensure the equipment is clean and in good working condition. 5. Select a suitable area for the probe, usually the index fingertip. Other sites that may be considered include earlobes, the bridge of the nose, and the toes. 6. Place the probe as directed by the manufacturer's instructions. 7. Ensure that the probe is detecting the patient's pulse and that the oxygen saturation reading appears on the oximeter. 8. Once oxygen saturation monitoring is complete, remove the probe and ensure that the patient is comfortable. 9. Clean reusable sensor and equipment with an alcohol wipe. 10. Wash your hands using soap or alcohol gel. 11. Record oxygen saturation in the patient's record as SpO2. Record if the measurement was taken with the patient at rest or walking. 12. Complete documentation. Now let us see a demonstration on pulse oximetry. Note that the equipment, material and procedures used here could be different from those in your hospital setup. Understand the technique and then apply it in the context of your healthcare facility.
Welcome to a video on pulse oximetry. This video is brought to you by Vadvani Foundation. Items required: pulse oximeter, alcohol solution and water. Preparation: ensure that the patient is comfortable and warm enough. Wash your hands thoroughly with alcohol solution. Procedure: check the probe and ensure the equipment is clean and in good working condition. Place the probe on the index fingertip. Other suitable sites include earlobes, bridge of nose and toes. Ensure that the probe is detecting the patient's pulse and the oxygen saturation reading appears on the oximeter. Once oxygen saturation monitoring is complete, remove the probe. Wash your hands using soap or alcohol gel. Complete documentation in the patient's record.
Always remember to complete your documentation after the procedure. Let's take a look at the hazards and limitations of pulse oximetry. Care should be taken at the probe site to prevent tissue damage from long periods of contact or tight application. The main hazard of pulse oximetry is getting an incorrect reading and thereby incorrectly treating the patient. An incorrect reading can occur due to reduced peripheral blood flow, venous congestion, partial obstruction of the veins of an arm or leg, bright overhead lights such as in an operating theatre, shivering or significant repeated movement of the sensor. Nail varnish may cause falsely low readings with most pulse oximeters, especially those colored blue or black.